So for today, May the 5th, we have had only 8 new cases test positive today, bringing our total number of cases in British Columbia to 2,232. That includes 849 people in Vancouver Coastal Health, 1,031 in Fraser Health region, 124 people on Vancouver Island region, 177 people in Interior Health region, and 51 people in Northern Health. We continue to have active outbreaks in long-term care and in assisted living and acute care, and we have 22 active outbreaks right now, including one new long-term care facility outbreak, Evergreen House in Vancouver Coastal Health, and 2 new outbreaks in acute care units, one at Ridge Meadows Hospital and the other at the Richmond Hospital, both again in Vancouver Coastal Health. That brings our total number of people who are positive for COVID-19 in our healthcare system to 442, including 271 residents and 171 staff. On a positive note, however, we have 17 outbreaks that have been declared over in long-term care and assisted living, including one of our very first one, the Lynn Valley Care Centre outbreak is now officially over. And all of the people who were affected in that facility have recovered now, which is really great news. In addition, the MSA Manor outbreak and the outbreak at Hawthorne Park Orchard Manor in Interior Health have been declared over. In terms of our community outbreaks, there continues to be 7 cases at the Fraser Valley Specialty Poultry. I understand that even though the investigation is ongoing, the inspection of the facility that was closed for a number of days, and the facility has put in the appropriate measures and has now reopened. Superior Poultry, we continue to have cases there with an addition of 1 case up to 55 and 35 cases at United Poultry. We're now at 134 cases. We continue to be at 134 at the Mission Federal Correctional Facility, including 121 inmates and 13 staff. And the outbreak investigations continue in all of those areas. We have now 78 people with COVID-19 who are in hospital in British Columbia, and of those, 21 are in critical care or ICU. Sadly, we have had an additional 4 people who have died from COVID-19 in the last day. 3 of those people in in the Fraser Health region, and 1 in Vancouver Coastal Health. And as always, our hearts and our thoughts go to the families and the caregivers and the communities of these people. We have 1,472 people who now have fully recovered from COVID-19 in British Columbia. Yesterday, we shared information on where we have been and where we may go in the coming weeks with COVID-19, with our pandemic here in British Columbia. And what I need to remind everybody is that we are not yet through this. We are, as I mentioned yesterday, very likely at the end of our beginning, but there's a long way to go for all of us, both here in BC, in Canada, and around the world right now. The orders and restrictions that we have put in place are still in place. So please don't start planning your play dates and expanding your bubble too soon. We need to hold the line right now. We still have outbreaks that are happening in our communities and in our long-term care and acute care facilities. We have put the brakes on it, for sure, and that is a testament to the work that everybody has done across this province. But we have not yet stopped this train. And as the modeling has shown, moving too quickly can undo all of the work that we have done. We must continue to hold the line on COVID-19, even as we gradually ease some restrictions in the weeks ahead. Finding that fine balance that is unique for us here in BC for the experience that we are going through with our pandemic. It is a global effort, but it's also an effort that we need to do here together. Our new normal, the principles that I talked about yesterday, will apply to everybody. And as I said, there are some things that will not change in the coming weeks and months. These are our playbook for the weeks and months ahead. We need to keep them top of mind and use them as the guideposts for our actions in the coming weeks. Equally important is making sure that others, so the different sectors that are opening up in our community, in our business, in our economy, we need to have these measures in place to give us all the confidence that when we go into a store, if we go to the park, that we're with our family, that everybody else is taking the same measures as well, and that we're taking care of each other by doing these things. None of us know the circumstances of the people that are around us, so we need to continue to be kind to them and not make assumptions, to be tolerant with everybody, and making sure that we support us all. We know that this has been a very trying time for everybody, and that sometimes that can lead to anger and frustration. We need to remain calm and remind ourselves that it's kindness that will help us get through this. I'm going to talk very quickly about our principles again, and you will hear us talking more about these in the coming days. We need to stay informed and stay prepared, and part of my role and our role is to make sure that we give you all the information you need to do that. You need to continue to clean your hands and cover your mouth when you cough and avoid touching your face. With no exceptions, we need to be very vigilant about staying home and staying away from others if we have any sort of illness. And this is going to be incredibly important, not only for the coming weeks and months, but as we go into the respiratory season next fall. We need to maintain our physical distancing when we're outside our home, when we're in the community. That's a way that helps us protect each other. Few faces and big spaces is what we need to think about. No handshaking or hugging for right now, for the people that are outside your household or your pandemic bubble. Keep your number of contacts low, in particular if you have people in your household, in your family, who are more vulnerable to having more severe illness from this disease. And outside is always preferred over inside. We need to make the necessary contact that we have when we're close to each other safer by putting in place some of those administrative or engineering controls that can help us have safe close contact. That includes those plexiglass barriers or reducing the numbers of people in a shop, for instance. We need to continue with our increased cleaning of those high-touch areas, both at home and at work and in the community when we're out and about. And we need to consider the use of non-medical masks for those short periods of time when we may not be able to keep our physical distancing. In addition, we need to be very cognizant about reducing our non-essential travel and what that will look like in the coming weeks and months. More than ever, as we continue to face COVID-19 and our pandemic here in BC, what we do today as individuals makes a difference to us all. And we've seen that in the past few weeks, how important and how effective that is. Our shared health and well-being relies on all of us to work together on this and to support each other. And today being Mental Health Week, it is ever more important that we maintain our social connections and our support for each other. Side by side, we're far stronger together, even though we may be apart. So let's continue to be strong, but also to be kind and to be calm and to stay safe.